tracked or traced. So we have the testing of nuclear devices here, and then we have the grave, the burial of nuclear waste. Everybody's familiar with the WIPP site. We're under consideration now for a high-level waste site near WIPP. It's called Holtec. The proposal is to bring spent nuclear rods, most of them plutonium rods, from power plants, nuclear power plants from all across the country on rail cars to be buried in the ground here. I always tell everybody they're going to tell us it's safe, and seemingly it is right up until the moment it's not, and then it's catastrophic and no one ever returns. Look at us. We've been waiting for 76 years for somebody to come back after Trinity. And so we are a sacrifice zone. We have the cradle to grave process taking place here. It's very unfortunate. I always say our kids deserve so much better than this, but it does influence human health in New Mexico. And that's why I'm so grateful to have this opportunity to talk to you guys about this subject matter. So I'm going to move into a couple of things that I want to cover. One, the specifics of Trinity that made it so fallout producing. Two, the lifestyles of the people in New Mexico in 1945 and why they were maximally exposed. Three, I'm going to talk a little bit about family histories. And then I'm going to talk about the Radiation Exposure Compensation Act. The Trinity test was the only test ever conducted on a platform 100 feet off the ground. They learned a lot from Trinity. What they learned is you can't detonate a bomb 100 feet off the ground without producing mass fallout. What happens on a platform 100 feet off the ground is that the blast comes down and intercepts the earth, has nowhere to go, takes up an enormous amount of plant, animal, dirt, and sand, incinerates it because Trinity produced 10 times more heat and light than the sun, and then creates a fireball that ascends and just keeps growing and growing and growing. And the fireball actually exceeded the atmosphere and penetrated the stratosphere. It went over 7 miles into the air. Obviously, everything that goes up like that has to come down, and it did, as a radioactive ash that fell on the communities surrounding Trinity for days afterwards. They traced the major part of the plume all the way to the Atlantic Ocean. On its way there, it actually damaged film that was being produced at a Kodak plant in Indiana, that far away from Trinity. So obviously the fallout was very, very radioactive. They learned from the Trinity test that to produce destruction, they had to detonate the bombs much higher in the altitude. And so when they went to Japan, they detonated those bombs at 1,600 and 1,800 feet respectively, which obviously had a whole different effect. They detonated the bomb high enough to where the blast came down, and then it created destruction laterally. And that's why you saw the destruction that you did in Japan, and produced much less fallout in Japan. The other thing about Trinity that they didn't know at the time of the detonation is exactly how much plutonium would be necessary to get the bomb to detonate. So they overpacked it with plutonium. It was very inefficient. They put a full 13 pounds of plutonium in the bomb. Only 3 pounds were necessary. That meant that 10 pounds of the most dangerous substance known to man, plutonium, with a half-life of 24,000 years, went up in that fireball and then dispensed plutonium all over the Tularosa Basin and likely in many parts of New Mexico. I don't have to tell you, you only have to ingest, inhale, or absorb 1 particle of plutonium. It remains in your body forever, damaging cells, tissues, and organs, and leading to many of the health problems we've seen people suffer with afterwards, like cancer. The government, though, did full well know that radiation was dangerous to human health in 1945. This was a very well-known fact. A fact then, they were already very well aware that plutonium was deadly to human health. And so this idea that they didn't know what they were doing when it comes to spreading fallout and damaging people's health through radiation is absolutely false. They knew all those things in advance of Trinity. They also knew that it was going to produce fallout. Remember the 100-ton test that I spoke about earlier. So they knew that there was potential to spread radiation to the communities adjacent to Trinity. So let me talk about lifestyles real quickly. In 1945, in most of rural parts of New Mexico, we had no running water. There was not that, that wasn't something that was available to people in rural parts of New Mexico. So what did we do? We actually counted on and depended on the rain that came down, and we collected it in cisterns and containment vessels, holding ponds, We very much depended on our acequias or irrigation ditches, the rivers and creeks that flowed down from the mountains surrounding the area. All of those things were very, very much relied upon for the purpose of gathering drinking water and water for cooking and bathing and cleaning, etc. Well, I don't have to tell you, July is our monsoon season. We had a massive storm after Trinity that likely brought down the largest particles of radioactive fallout, and then that became part of people's water supply, obviously. The other thing is, if you don't have running water, you don't bathe as often. So as a matter of fact, if you were exposed to the ash that fell from the sky, it likely got on your scalp and in your hair and on your body, and you didn't have a chance to wash that off until you were able to take a bath again, or be able to wash yourself off adequately to get the radiation off of your skin and your scalp. And so people were exposed through the water that they were drinking, and they were exposed through not being able to wash themselves adequately afterwards. We also didn't have electricity. A lot of people don't realize this as part of our history, but in 1945 we did not have electricity widely available, so we didn't have refrigeration. We didn't have grocery stores. We had mercantiles, and what you could buy in a mercantile was salt, sugar, flour, rice, cereal, coffee, but you didn't buy produce, you didn't buy dairy, and you didn't buy meat. All of those things were, you attained all of those things through your own processes at your own home and in your own community. We had very active dairies in all those small towns, and people also had their own milk cows or goats. They raised sheep, pigs, chickens, all of these things, cattle, all of these things for the purpose of meat, and we hunted a lot. We hunted for small mammals, for birds, for deer, if we were lucky, and so all of the meat that we ate, we produced ourselves. We all had gardens and orchards. Obviously, the soil was now contaminated, and the water that we were using to irrigate those crops was contaminated, and so those things were contaminated as well. The sad thing about it is women would have been spending a lot of time outdoors in July, gathering everything they could from their gardens and their orchards, and processing that either through canning or drying of those things for the upcoming winter. And people in July in New Mexico would have been outdoors a great deal of the time, because they were spending so much time during that time of the year trying to, gather and produce as much food as they could. And it was just part of our lifestyle. And so obviously people were receiving a maximum dose just in feeding themselves and in drinking the water that they were collecting. So in my family, I'm the fourth generation since 1945 to have cancer. The two great-grandfathers that I had living in Tularosa at the time died in 1955 of what they were told was stomach cancer. Obviously, in small towns, rural parts of New Mexico in 1955, there were no medical facilities. Both of them did make a trip to El Paso. They were both told they had stomach cancer, and they were given morphine and sent home to die, and it was a horrific few months for them. My two grandmothers both had cancer, although that's not what they died from. My father died from 3 cancers. 2 of them were horrific cancers. One of them was at the base of his tongue, that took a great deal of his life away from him. He was on a feeding tube for an extended period of time, lost massive amounts of weight, eventually lost all of his beautiful, perfect teeth to this, and then got prostate cancer, and then 8 years after the first oral cancer developed a second one that wasn't metastatic. They knew that on a cellular level. My dad didn't smoke, didn't drink, didn't use chewing tobacco, had no viruses. I asked the doctors, how is it that this happens? And they said, we don't know, but we see a lot of this in New Mexico. Well, I do know now. My father drank an enormous amount of milk as a child. It's very likely that he concentrated the radiation in the glands of his neck, and it continued to give off radiation and damage the cells and the tissues in his neck. I had thyroid cancer diagnosed when I was 39 years old, and the first question they asked me was, when were you exposed to radiation? Did you ever work in a lab facility? Did you ever work with radioactive isotopes? I said no, no, and no, but I lived 45 miles away the crows fly from the Trinity test site. Little did I know at the time that New Mexico was also downwind of the Nevada test site. This is very well documented. The government kept good records when they moved the testing to the Nevada test site. They did well over 100 above ground tests there. They dosed the people in New Mexico and other places through the summer of 1962 with those above ground tests. Again, that is all very well documented. My sister's being treated for cancer now. My dad's oldest sister, who's 81, just finished her radiation for breast cancer. My mom's sister died from breast cancer. And my family hasn't been as affected as others. We've been collecting health surveys for 14 years now. We figured if the government wasn't going to come back and do something like that, that we would take care of that. And so we've been collecting health surveys for 14 years, and the family histories are just remarkable. You can go to our website, which is in the chat, www.trinitydownwinders.com, and read some of the stories that we've recorded there. The other thing that I want to mention is that we had a spike in infant mortality in the months just after Trinity. You guys may well know the history of this, but after a 10-year decline in infant mortality all across the state of New Mexico, as a result of the advent of antibiotics and better hygienic practices, we saw this steady decline in infant mortality. And in 1945, at the beginning of the year, we were at something like 30 babies per thousand dying in New Mexico. And then right after the test, there was this enormous spike in infant mortality, and it went from something like 30 per thousand to over 100 per thousand. We actually had the highest infant mortality in the whole country as a result of Trinity. I always say our babies were dying, and we did have casualties from Trinity, and they were our babies. One of the reasons for that is that babies' bodies are smaller, and your exposure to radiation is a factor of your body mass, so they would have received a very large dose. And then on top of that, their mothers would have been concentrating the radiation in their mammary glands and then breastfeeding their babies and literally poisoning them. This part of the story is the most tragic for me, and part of it that I find unconscionable, because there was a healthcare worker in Roswell that contacted the Manhattan Project and said, can you think of anything that we might be able to do to save our babies? They're dying at an alarming rate. Nothing we do is working. And they were dying from a dysentery-like syndrome, which is exactly how babies would die who were overexposed to radiation. The Manhattan District Project decided that the best thing to do was deny and deflect and say, we don't know, and we know of nothing that could be causing it, and we know of nothing that could be helping with it. So where are we now? There was a fund set up 31 years ago in 1990 called the Radiation Exposure Compensation Act, or RECA, to pay partial restitution to people downwind of the Nevada test site and some uranium miners, and then offer some health care coverage as well. That fund has never included the people of New Mexico, and it's only included uranium miners that mined before 1971. Now you might ask, why 1971? Well, that's when uranium became commercially available for use in nuclear power plants, as an example, and our government said, we're not going to take responsibility anymore, even though we still buy uranium. Industry is buying uranium, and so now we're going to shift the responsibility for the sicknesses over to industry, and everybody knows what happens when you do that. Industry never takes care of people. And as far as the New Mexico downwinders, we were the first people ever exposed to radiation any place in the world, and we've been completely forgotten and left out. The fund has paid $2.5 billion in restitution, and again, that would be so meaningful for the people of New Mexico. So for 11 years, we've had bills entered in Congress, and we have bills entered right now. And we're working very, very, very hard to make sure that these bills get passed, because the original RECA bill will sunset in July of 2022. If we're not added this go round, then it's likely, and if the bill sunsets, it's likely that the people of New Mexico will never, ever receive the restitution and the health care coverage that they so desperately need and desperately deserve. The restitution ends right at the New Mexico-Arizona border. I always say as if there's a lead curtain there that has somehow offered us protection, and we all know that's not true. So if you live 5 feet into Arizona, you're taken care of, but if you live 5 feet into New Mexico, you're not. A distance of 10 feet. That's how ironic and ridiculous this is. We are fighting for the restitution to be increased from $50,000 to $150,000. You would be able to apply on behalf of a deceased loved one. It would be extended to the entire state of New Mexico because we truly believe everybody in New Mexico is a downwinder of one thing or the other. It would also include health care coverage for anybody who's suffering with one of the compensable cancers and has lived in New Mexico for 1 year between 1944 and 1963. We had pushed for a longer qualification period, but Congress says that when the above ground testing ended in Nevada, nobody else was affected after that. We obviously believe there's a multi-generational facet to this, that we pass on genetics that are damaged and that our children and our grandchildren will likely see the effects of this. But I will tell you that the restitution and the healthcare coverage is likely to be transformational for the people of New Mexico because it has the ability to bring a lot of money back for the people of New Mexico and the much needed healthcare coverage. There are also clinics that will be established in New Mexico that will do nothing but screen people. They're called RECEP clinics. Those clinics will be here for no other purpose but to screen people in New Mexico for cancer so that we have a better chance of a good prognosis because our cancers are caught earlier. That's not the case now. I'm going to give you a quick example that I hear all across the state as I travel to do this work. People tell me a story that goes something like this. I had a great job, I had a retirement, I had health care coverage. My wife and I were looking forward to me retiring and us possibly helping our children go to college or buy a home. But I had this nagging pain in my belly and it wouldn't go away. There's no health care facility where I live, so I put it off. Finally, my wife made me an appointment to see a gastroenterologist in Las Cruces. I went. I found out I have stage 4 colon cancer. They sent me to El Paso to see an oncologist. I was having to travel there 5 days a week for chemotherapy. I tried to keep working, couldn't sustain that. Landed up having to leave my job, lost my health insurance, have spent all of my retirement, have taken out all of the asset in my home, maxed out 3 credit cards, and now my kids are sending me Visa gift cards to use to buy gas so I can get to and from my trips to El Paso. And most days I wish I would die so that I wouldn't be a burden to my family anymore. And honestly, we'll never contribute to a child's education. We'll never have the ability to help a child buy a house, and I'm a burden to my family, a financial burden to my family. And I hear this everywhere I go. I heard the same very sad story one day in Laguna Pueblo as I interacted with uranium miners there. So the economic impact this has had on our state, we will never fully understand, but what I can tell you is that if we bring this restitution back to New Mexico, it will be transformational. We've been health surveying in the town of Carrizozo this summer, and I said to them there, if only 100 people apply and receive the restitution that you can apply for on behalf of your deceased loved ones, if only 100 people receive it, that's $15 million. When's the last time $15 million was put into the economy of Carrizozo? It doesn't happen. And so when we live in a state where 47% of the people use Medicaid to access health care, I can tell you that through our health surveying and asking that question, most people who are downwinders have said that they either access healthcare through Medicare or Medicaid when they have cancer and they're dying. So with that, everybody on this call can join us in our efforts. You can go to our website and you can find all the information you'll ever want about what we're doing and how you can help us. But everybody in New Mexico should be pulling for these bills to be passed because it will have, like I said, a transformational effect on the people of New Mexico when they are facing a cancer diagnosis. And for those families who've lost member after member after member to cancer, it will be transformational because it will bring that restitution back to their families that obviously was long ago spent to try to keep their family members alive. And I'll be glad to answer any questions or entertain any comments or suggestions that anyone might have at this point.
Thank you, Tina. We have 4 questions in the chat right now, and I'll go ahead and ask the first one. Who funded the restitution that New Mexico was left out of?
It's a federal program. It was developed in 1990. It's called the Radiation Exposure Compensation Act. Again, it's a federal program. Congress passed it back then. Why New Mexico was left out, I have no idea. And I always say that's the $2.5 billion question, because that's how much has been paid out through the fund. And again, we're working with Congress right now to get that bill amended to include the people of New Mexico, and not just New Mexico, but there are other parts of the western part of the United States that were downwind of Nevada and never included, states like Idaho and Montana, and even the Pacific Islands, where our government did some horrific above ground and underwater testing that damaged those islands forever, and where we have downwinders as well.
Great, thank you. And let's see, and we have another question. Besides the bills pending, are there legal actions for New Mexico reparations?
That's a great question. We're in conversations right now with an attorney to talk about potentially filing a class action lawsuit, especially in regards to the infant mortality. We've been doing some massive research, and let me tell you all, I think the infant mortality is the part of the story that none of us should look away from. We know, as a matter of fact, that most babies in 1945 were delivered by a doula or a midwife at home. And so we even think that the infant mortality numbers that we're seeing are understated, because a lot of babies that were born at home, their births and their deaths were not recorded. So yes, we're considering that, and that is exactly how RECA originated. Senator Udall's father, Stuart Udall, went back to Utah after retiring from government work, and saw for himself that people were dying from cancers, and he realized that it was likely related to, number one, the uranium mining that was going on in the western part of the United States, and number two, the testing at Nevada. So he filed lawsuits on behalf of plaintiffs from all over the western part of the United States, but mostly Utah. And they were winning in the courts at every step, but the courts was continuing to say that they couldn't hold the government accountable because it was in the interest of national security, so they didn't pay damages. He finally realized, after making it all the way to the 10th Circuit Court of Appeals, that the only remedy would be a political remedy through enacting a law in Congress that would somehow try to make these people whole. And all they ever paid them, each one of them, was $50,000, which is a slap in the face for all the sacrifice and suffering that people have been through as a result of their overexposure to radiation.
And Tina, I know you touched a bit on infant mortality, so I think this goes into the next question about are children and families continuing to be exposed today? And also, are you seeing with the high cases of cancer, does this impact the amount of COVID-related deaths in the area?
Those are such excellent questions. Long ago, when COVID first started, we sent a memo to Congress, and we said that because of our underlying health conditions associated with the cancers that we have survived, we are going to see bad outcomes inside of a pandemic. And that is exactly what we have seen. I work with members of the Navajo Nation, Laguna and Acoma Pueblo, on what's called a frontline community group, and they have seen great numbers of people die from COVID who were cancer survivors or who have lung disease associated with their mining activities. The same thing has happened in our small communities all over southern New Mexico. Tularosa, for example, I know many people who died from COVID because of their underlying health conditions, and they had survived cancer only to get COVID and die. So there's no way, and I know of a young man who is a journalist that actually was in New Mexico a couple of weeks ago studying this to write about it, about how we probably saw a really bad outcome in New Mexico associated with the fact that we have all these downwinders here and these uranium miners. So the answer to your question is absolutely. We have seen a terrible outcome with COVID in some of these communities because of people's underlying health conditions associated with their exposure to radiation. And the first part of the question, Geraldine, I don't remember. It was about infant mortality. Can you tell me what that was again? I don't know if I answered it.
Just the question if you are seeing still children and families being affected today.
So we will never fully understand what our exposures are today, and let me tell you why. The government Anecdotally, many people have told me they came back and took soil and water samples from our farm or from our ranch for years afterwards, but we've never seen a report. And we're actually hoping to submit some FOIAs this year, Freedom of Information Act requests, asking for that information about any soil and water sampling that was done after Trinity. But what I can tell you is when the government doesn't publish information about those sorts of things, it's usually because it's not going to be a good report. When you are looking at an isotope of uranium with a half-life of 24,000 years, I always say yes, there's the likelihood that we're still being exposed, but we'll never know for sure because the government's never come back to take a look at this. What I do know is they continue to detonate devices out on the White Sands Missile Range. They not only detonate devices out there, they launch rockets and missiles from other parts of the country to that site. And then we have the high winds that we have here in New Mexico, and it stirs up all of that particulate matter over and over and likely spreads it all over New Mexico. And so, you know, we're sort of in the perfect storm of this. We live in conditions, unfortunately, that create the perfect storm for this. The fact that they continue to detonate devices out there, I interviewed a couple of men 3 years ago who told me that they were photographers who worked for Dynalectron that photographed these explosions that they would do out there. And they were telling me that one time they worked on a project where they detonated a device that actually created a crater that was 12 stories deep, and they sprung water. And you can just imagine the type of dust and debris that's created by an explosion of that magnitude. The Trinity test didn't create a crater anywhere near that size. So they said it was 10 times more powerful than Trinity. So yeah, I think that we probably do still experience exposure.
Well, thank you so much, Tina, for joining us today and talking to us about the fallout from the nuclear radiation. It's a really bigger part of our efforts in public safety and health equity. You talked about water contamination, the vegetation and livestock being affected, and then a lot of our health councils do work with a lot of those exposed populations, Indigenous, people of color, low income, rural areas, and those facing barriers to receiving adequate health care and all the things that you talked about. So I just want to thank you for joining us today and sharing with us how health councils can be more involved with the efforts around the nuclear radiation. So if you can just put your email in the chat, so that way if we have any other follow-up questions, you can make those connections after our health councils talk. So thank you for joining us. And we are so happy to have you today. And so we'll go on to our next presenter, and that is going to be Katie Diffendorfer from New Mexico Department of Health. So she'll be discussing the connection between community and DOH through effective communication strategies. And part of that is our aim to prioritize health council perspectives and community voice, which is so essential in creating messaging content. So Katie, it's all yours now.
Hi. Thanks. Wow, Tina, that's such an impactful presentation. I'm just speechless, which is bad because I'm supposed to be presenting. But hello, everybody, and thank you so much for inviting me today, Sharon and Geraldine and Michelle and Roberto and other people who have supported my new role as Health Equity Communications Manager through the Department of Health Communications team. Today, I want to reaffirm that the DOH values community voice and community-led messaging. We care about your input. We want to listen more, respond faster, and offer resources to collaborate, co-create, and support the development of community-centered messaging materials. We recognize that the end of this pandemic depends on communities being engaged, and that that can't be achieved with a one-size-fits-all top-down messaging structure. Instead, we need to listen to community voices and hear different perspectives without judgment. That's just the only way to truly understand the concerns about the COVID vaccine, what type of resources are needed, ways to collaborate on messaging, how to convey it effectively, and so we can all beat this together. As a health equity communications manager, I have a cool job because I sit at the intersection of collaboration. I'm part of the DOH communications team. So I'm involved in broad marketing campaigns and press releases and media events, but I also get to listen to, learn from, collaborate with community partners, health councils, youth advocates on more focused messaging. So I can bring these insights back to the marketing team to inform their strategies, which is helpful. But the one size fits all marketing campaigns just aren't as effective as boots on the ground community led messaging. So, with content created by and for the communities themselves being the most effective of all. And, this week, the Grant County community members did that video, which was awesome. And, those heartfelt messages are so much more impactful to their own communities than any broad marketing campaign ever could be. And because that video was shared with me yesterday, I was able to get it on the DOH website and socials today, so it can help other communities. So that's the kind of thing I do. I can share about your events. I can share things like that, your videos and community resources. Especially now that the need for focused messaging is clear. New Mexico has one of the highest rates of vaccinations, yet we're in crisis standards of care. With daily cases hovering around 1,000. Yesterday, we were almost 2,000. And why? What barriers contribute to vaccine hesitancy? Are we listening to community voices who have some of these answers? Are we respectfully engaging and collaborating on more effective community-led messaging materials? Is the DOH allocating resources in the most impactful ways? Are we looking for opportunities for deeper understanding and responsive messaging? As COVID infection rates continue to rise, there's not only an opportunity, but a real need to listen and learn from those with lived experience and a unique understanding of their community's values, beliefs, and cultural perspectives. To seek opportunities for two-way learning and promote co-ownership of the messaging. So focus groups, listening sessions, virtual town halls can all be useful. Maybe more community working groups where community members come together to design and deliver messaging to their own communities could be effective. However, it's achieved in the context of COVID prevention through vaccination and other things, it's hard to imagine anything more urgently needed than the development of more community-led messaging materials. According to the National Resource Center for Refugees, Immigrants, and Migrants, communities are the best reporters of ongoing evolving concerns surrounding the vaccine, what messages are consistent with their beliefs and values, whether statistics or personal anecdotes are more effective, whether messages should come from community members, leaders, or professionals, and if messages should be conveyed via social media, text messaging, or other avenues. I've heard that the DOH messaging isn't always effective, that it's too broad. Many communities can't relate to it, feel dismissed by it, or even insulted by the lack of connectivity or empathy. Being told to talk to your primary care doctor when you don't have one, or maybe are homeless or houseless, doesn't track. And people don't want to be told what to do. They want information and then the respect to make their own decisions about their own lives. So if it isn't working, maybe this is where my intersection can come into play as a resource to collaborate or tailor materials that are more responsive to your community specific needs. I can offer support by streamlining content to your specifications, or creating PSAs for television. I have resources to contribute to that, creating PSAs for television and radio, offering video production services, including shooting and editing. We have a videographer on staff at the DOH. And I'm a former editor, television editor with more than 20 years experience, also as a television live news producer. And of course, personalized flyers. I can publicize your community events through DOH infrastructure, press release, media outlets, and regional publications. In partnership with community health workers and agency stakeholders, we have resources to share, such as the community-based printing outreach, which has been a huge success, and the Better Together grant, which can support the development of community-led materials, messaging materials. As an example, this week, the New Mexico Department of Homeland Security and Emergency Management released an information sheet. I'm smiling because this is where I'm supposed to do the technical part. And I already told Geraldine I'm going to try, but maybe she can help. They released this one sheet, and this is the pared down version. It's great. It has a ton of information. It's about the COVID Funeral Expense Assistance Program. And FEMA is concerned because even though 1.5 million has been spent, the response to an uptake of the program resources, it's low. They don't know why people aren't using it. So this was the simplified version. And I mean, it's a lot of information. It's great. It's a lot of information. And so a lot of people might not be able to process all that right away. So we simplified it. And I made this graphic yesterday. The other one. Do you have the other one, Geraldine? Or I can try to.
I can share that right now.
Sorry, yeah. There it is. Yay, thank you. So, okay, this is the simplified version. And, you know, there's a lot of great information on the other one, but people are going to look right past it. You know, there could be language barriers. There could be all sorts of barriers to people even noticing it. This has just a few bullet points, 5,000 per New Mexico registrant, who it's available to, who it's for, and then a number to call for more information. This is the kind of thing you can print up for free using the CHW Community Printing Outreach program. You can take it to community centers, drop it off at your friend's house. It's more usable. And it's an example of how, you know, we can together share resources to simplify some of the confusing messages. You know, just so they're easier to use, so the information can get where it needs to go. And this changes by the communities. So everyone wants, you know, a different thing and different perspective. And so that is why the community voice is so critical. So I kind of rushed through this, but I just wanted to thank you again for inviting me and sharing your time today. You know, the information that you provide is incredibly valuable. So I look forward to hearing from you and collaborating with you, hearing your feedback, concerns, and anything else. I'm here as one of the many resources available to support the development of community-focused content. And I really look forward to contributing to the co-creation of a more effective messaging strategy for our state, and one that is, you know, community-led and focused.
Okay, Katie, thank you. And we have some questions here. So I have one specific for the flyer, and is undocumented persons, are they eligible for that funeral assistance?
As I understand it, the person applying, the person who is deceased can be undocumented. The person who is applying for the assistance can't. But again, it's a great question. And so, but that's why it's important, you know, the number and the FEMA information and all of that is on that flyer. And of course, they can contact Brian Saylor as well for details on that program as well. That's, I think, as I understand it.
Okay, and is this messaging available in Spanish?
Yes. Yes, we have translation services at the DOH, and that is something I can provide.
Okay, and we got another question saying, how do people access these resources? If there's a link that you want to drop in the chat, that would be helpful too as well. And,
yeah, let's see. You know what? It's me. So I'm gonna put my email in there. Even I can hardly spell this last name. And I invite you to reach out to me anytime with your requests and your feedback and anything else. You know, I'm doing things like organizing town halls and you know, focus groups and other things. I'm going to be doing different things by region as I'm allowed to, and it becomes evident. But in process of all this, I'm available to you, everyone across the state, just to reach out to me and say, this flyer doesn't make sense. Can you give us the important part? We want that highlighted on the flyer. I'll get that right back to you. You tell me I don't like the design, we co-collaborate, get it done, and it's pretty quick.
Okay, Katie, and for health councils who are interested in collaborating with you as far as some of the support services that you offered, such as streamlining content, creating PSAs or video production, how much lead time do you need for that?
Thank you. That's a great question. You know, it depends on what's going on. You know, like today I got a request for something. I'm going to try to work on that this afternoon and have it back to them on Monday. So always I will make it as quickly as possible, because I feel like, especially now, time is of the essence and the messaging is changing so quickly, and we're in crisis standards of care, and we're at such a critical emergency place with our state that it has to be a first priority for me.
Okay, so it looks like we're getting some feedback in the chat to share the flyer, and I could also, Katie, if that's fine with you, could I share that in the chat?
Oh yeah. Oh yeah.
Okay.
Yeah. Thank
Okay.
you for that technical help.
Yeah, no problem. And we got a question saying, we see a lot of stuff coming from DOH about getting vaccinated, but what about some stuff? What about some stuff on what to do if you get COVID?
That's great. I mean, there's some wonderful treatments coming out, monoclonal antibodies and other things to help keep people out of the hospital. And that's great feedback, because we have some of those flyers, we have some of that messaging, and we can hit it harder. So that's exactly the kind of thing I want to know. If that's what you feel your community wants to see, contact me on that, and I can get you the flyers we've got right now. And we can talk about ways that to get them printed up, or what makes most sense for your community.
Okay, and are there any other additional comments or questions for Katie at this time?
Katie, I do have a question. Thank you so much for this. This is really great. I know that you're not the one that manages the funeral assistance, but I wonder if on the top of your head you happen to know. So we have a lot of mixed status families, and the ones applying could very likely be undocumented. So I think that's unfortunate, but I get it because it's federal funding and that just can't be. But is there an age where, like, so for example, how old does the person applying have to be? Do you happen to know the answer to that question? Because there's many mixed status families. And so maybe there's a child that is US born, but maybe they're not quite 18, maybe they're 17. So I was just curious if you happen to know that.
You know what? I would love to know that. I don't know, because this is the first I've heard of this funeral program this week. And if you find out, I'd love to know, because that's so legit.
Yeah, and so
legitimate.
If there's someone at DOH that's, or whoever's handling that, if you're in contact with them and you get that information, I would definitely put that on the flyer that's in Spanish for sure. It's just a suggestion.
That's great. Thank you for that feedback.
Katie, and I know in addition to the support services that you offer, is there a specific, maybe like a designated place that DOH has, like a website where you can get communication materials that have already been like finalized and already for community members to share?
That's a great question, and I think we need to improve that system. We do have those things. We just have to figure out how to make them accessible. And thank you. I'm going to write that down. That's a great question. In the meantime, feel free to contact me.
Okay.
Yes.
And we have a comment from Sharon saying she just wants to make sure that Health Council Talk participants know that you were invited to the DOH Equity Committee meeting at 1 p.m. So, and part of that is dealing at 1 p.m. and we're talking about how communities can engage in dealing with the COVID emergency response in our state. So just the comment there. And do you have contact information for the person in charge of the funeral benefits program? I think that was already discussed with Susie, right?
Yeah, but I'm putting it in there. His name is Brian Saylor, and he is the PIO for the what's the name of his New Mexico Department of Homeland Security and Emergency Management. So he's the FEMA contact. And he did a great job on the one sheet, but that just using that as an example of how simplifying some of this complicated stuff can make it just more accessible to people. And so I hope to be a resource to you, and please don't hesitate to reach out.
Thank you, Katie.
Thank you,
for
Katie.
having
So
me.
we'll be sure to get out your email and contact information for health councils to do follow-up with you, and to take advantage of all the resources and support that you're offering through communications. And I like how you mentioned communities are best reporters, because that's what our health councils do, and they serve a lot of the purpose in communication, and they know their communities best and what those communication methods look like, and what's the preferred method to go with. So thank you for joining us today. And if there are no further questions, we could close out today's health councils talk. And I'm just going to share quick brief updates if everyone can see this. So we are having our CDC Kellogg community rebuilding trainings on the 1st and 3rd of every month. And our next one coming up is December 6th. And then December 17th and the 20th. And so just a little reminder from our executive assistant, Madeline. So we're actually, the Alliance is making updates to the calendars. And part of this is sending out new calendar invites. So if you've seen those email blasts, it says add calendar function, and you can add it to Google Outlook. And the other options that are provided. So the best way moving forward is to remove existing calendars for the health councils talk and the CDC trainings, and use the feature that's provided through the e-blasts that have been going out by Madeline. And I hope that makes sense and doesn't create any further confusion. But we're trying to update our communications part of our conversation today. So and that's making sure that everyone has the same Zoom link. And if anyone has any other questions or comments right now before we log off, feel free to unmute yourself if you'd like. And also, Sharon did mention that we are having a health equity committee meeting at 1 p.m. and the Zoom link is in the chat if you would like to join. Okay, well, thank you so much for joining us and taking the time to meet with us during your lunch hour. It's been so great to hear from Tina and Katie. So everyone have a great Friday.
Thanks. Bye.
Bye.